I think you had this scheme that you work with the government of Karnataka for
Yeshashwini.
Yeshashwini,
Yes.
5 rupees per month for getting a basically effectively health insurance where your all kind of surgery will be covered.
Yes.
That, how did that come about? That sounds like so insane.
It's when I was a kid growing up in a small town, Syndicate Bank had a program called Pygmy. Pygmy collection is, there are pygmy agents who go from one house to the other. They collect 50 paisa, 1 rupee, 2 rupees from every housewife. And at the end of the year, it used to be a significant amount. So I used to ask my dad, with 50 paisa, 25 paisa, what is going to do? Then he said, that is how money is. You collect from large number of people. Those banks can do a lot of things. So that's the time I realized the power of small amount of money.
Right.
And around 3 years after we started the hospital, about 23 years ago, I think, there was drought in the state of Karnataka for consecutive 3 years. Farmers lost the capacity to buy healthcare. So my friends who are running hospitals in different parts of the state, they used to discuss with me saying that, look, OT is lying empty, patients don't have the money to pay. Those days, there was nothing like a government schemes. So one day I called all my friends. I told them, okay, let's start a health insurance only for surgeries. We'll approach the government. But one condition, they can only charge what it costs. Because right now, the entire infrastructure is lying idle. They all agreed. And we brought together 600 hospitals in state of Karnataka. Then we went to the government. Government agreed to become an insurance. They agreed to become a reinsurer in case we go broke. But they took over the scheme. That is the greatest thing. They owned the scheme. And we were the healthcare providers. And we ran the insurance for about 12 or 13 years. We had 4.5 million farmers paying 5 rupees per month.
Amazing.
And we networked with 600 hospitals. And when we finished the scheme, about 1.5 million farmers had different types of surgeries. And nearly 1.5 lakh farmers had a heart procedure.
Wow.
All this happened by 5 rupees per month. This is the power of India. We have a unique ability to do amazing things. I'll just give you one comparison, Mukesh. We run hospitals in Cayman Island. We have 2 hospitals there. It's one of the richest countries in the world. Significant number of people living in Cayman Island do not have data in their mobile phone. They can't afford it. It is too expensive. In India, beggars also have the data in their phone. Why? Only because of our population. As we have more number of people to share the cost, all these expensive services become extremely affordable.
And that's very powerful. I think at some level, now 1.45 billion people.
Oh, yeah. That is our asset.
That is really as an asset. In the past, we used to think, that's
it's a liability,
right? Seeing that as an asset because they're all, capable human being with aspirations. And I think this is quite instructive. I'm, thinking about, the 20 years ago, you and, with, other colleagues creating the scheme and making, something very important that, so if you have a heart condition, you need to obviously get operated on. You can't afford it just by paying 5 rupees a month. You were able to create a program. I think for entrepreneurs of today, it's a big lesson. A lot of, again, the easy thing to do is target the rich people in the country.
Exactly.
Build a product and service, and we know they can afford and how to target them and all of that. But you miss out on that because even today, number of rich people run out, after you first, 10 million families or something, the income start to drop pretty fast. So I think it's a great example for people to really think. Now I think I'm forgetting, who was this business professor from Harvard, the person of
Prahlad, C.K.
Prahlad. He is, fortune at the bottom of the pyramid, right?
But
this is a ultimate example of, creating, not with the intention of making fortune in this case, but still you're kind of showing the power of collective and what it can do.
We started a health insurance, Mukesh. Recently, around 6 months ago, we got the license to be a health insurance company. The idea of us becoming a health insurance company is based on covering working class families who earn about 20,000 to 60,000 rupees per month. They should be covered for any type of surgeries up to 1 crore rupees. There should be no difference between the poorest man and the wealthiest man when it comes to the question of falling sick and seeking care. You can have disparity in conveniences. You may not have money to build a house or a car or all the comforts. But when you are in pain, you shouldn't suffer.
Right.
So the strategy is that they should pay 10,000 rupees per year. And our entire family should be covered for any type of surgery up to 1 crore rupees. Now, what is the rationale of 10,000 rupees? When I started my career 36 years ago, when poor people came, they had hardly any money and they were only begging to save their life. Today, a typical patient of mine, they generally come from Eastern India. They sit on the chair with the baby on the lap and I examine the kid and I tell the mother that your baby requires a heart operation. She has only one question. That is, how much it is going to cost. If I tell her that it's going to cost 3 lakh rupees, which she doesn't have, that is the price tag on the kid's life. You come up with 3 lakh rupees, you can save your child. You don't have 3 lakh rupees, you will lose your child. This is what I do from morning till evening, putting price tag on human life. This is what every doctor does in most of the developing countries, from morning till evening, putting price tag on human life. There is something seriously wrong. How can we call ourselves as a civilized society when you officially allow people like us to put a price tag on human life? This is the tragedy part of it. But look at the brighter part of it. Today, that lady, she cries, she touches my feet and, begs. And it's very, actually before you came, I think some of your colleagues would have seen how they plead to save their life. It was very humiliating. But before they leave my office, all of them, today they will say, Ami 1 lakh dete pari. I can give you 1 lakh rupees. This lady who comes from a slum is willing to give 1 lakh rupees to save her child's life. That made me to think, if I have a health insurance with a premium of 10,000 rupees per year to cover her entire family for all types of surgeries, this lady today will have enough money to cover her family for all types of surgeries for the next 10 years. But she can't create that insurance. I can create. This is what will change the country. This is what will make things dramatically different. We always look at the future as an extension of the past. It is different. Because the tools what we have, today I'm empowered with the license to start a health insurance. I never thought I will ever get the license, right? Today, government policies have changed. They made people like us to have an insurance company.
At SparX, we aim to bring to you stories of exponential impact. We share in-depth analysis of what goes behind success stories. If you find our conversations interesting, you can join us by subscribing to our YouTube channel. You can also listen to SparX on Spotify, Apple Podcast, or any other audio platform of your choice. If you have any suggestions on who we should invite or what topics we need to cover, just let us know in the comments. We are always listening, looking for ways to improve, and keep getting better as we go along.